Good afternoon, New Brunswick, and welcome to today's healthcare update with Minister Shepherd. I'm Vicki Hogarth at the CHCO News Desk. Today we are going to be hearing about primary care option expansion. So a lot of this will likely have to do with the idea of having an appointment online if you don't already have a family doctor, how the province plans to address this. Now, I know in November there was an announcement that Minister Shepherd said she would be unveiling a plan in early 2022, so this is likely going to be it. I'm just listening for roll call, which we haven't done. There's Bruce right there.
Just going to do a quick
So don't mind me as I sort of wait to hear my name, just so we get an idea of how many journalists are in on the call as well.
Pascal Rachnac, Radio-Canada.
Hey, Bruce.
I know you've probably
Andrew Watt,
gotten sick of seeing me this week as we've had a press conference. I feel like
Vicki Hogarth, CHCO.
Hi, Bruce. There we go. Okay, so that'll give you an idea of how many people are in on the call. I can give you a quick recap right now just of the COVID numbers. This won't be a COVID update, however. So there were 1,189 new cases yesterday. 482 healthcare workers are isolating, either having had contracted the virus or being a close contact of someone. So that's an important number to remember when we're looking at things like, I don't know if you follow us on Facebook, but I did post yesterday on Facebook at a glance sheet that Horizon sent out about hospital capacities and whatnot. And it's really interesting to look at. I recommend just scrolling down on CHCO-TV on Facebook to see where I posted that. Gives you an idea of just at what capacity all these hospitals, Horizon hospitals specifically, where they are in terms of their capacity for both regular beds and also the ICU beds. And it gives you an idea of numbers of the number of healthcare workers who are off and whatnot. So that's really paints a picture of what we're dealing with beyond just COVID numbers. It's obviously an ecosystem of issues affecting where we are with healthcare right now. So today's announcement will be really interesting for those of you who maybe put off trying to see a doctor at this point in time. That's going to create further problems down the road if things don't get checked, because you're either scared of going to a doctor, going to the emergency room or whatnot. I think today's announcement will be a little bit about how this is going to work online. Now, I know Minister Shepherd had said in November a lot of it would be different family physicians volunteering to take on extra patients in an online setting. So we'll find out a little bit today. It sounds like there are quite a large number of journalists in on the call. So some questions that I'm thinking about asking that have to do with this specific announcement that we will be hearing from Minister Shepherd today, though I don't know the full nature of what it will be. But there are other factors that we have to consider no matter what the announcement is. For instance, about 35% of doctors in New Brunswick are going to be within retirement age in the next 5 years. And I think that number is a bit higher when we look at nurses too. So even if they come up with some kind of a system that addresses this, if we don't recruit new doctors and new nurses to New Brunswick or encourage people to stay in New Brunswick who have these jobs, we are going to run into other issues no matter how we address it with online options and whatnot. So I don't know exactly what the announcement is, so I will determine what I ask based on that. And also, if you're following online right now, if you're at home watching on TV, the best way to contact me is just by email. The email address under my name on the screen, news@chco.tv. That goes to the whole news team here at CHCO, all three of us. So we all see it. You can also use my name that you see spelled there, Vicki, VICKI.Hogarth, HOGARTH @chco.tv, if you want to just email me directly. I'd love to hear from you to find out what your questions and concerns are. It's how we formulate most of the questions that we ask in all the conferences come from having conversations with viewers, with New Brunswickers, to know what you're really thinking and feeling. And you've been so helpful this entire, I can't believe it's been
Good afternoon, everyone.
Oh, it sounds like we're going into the conference right now. So as soon as the conference is over, I will do a quick recap about what we've heard, but I will be following online with you as it's going on, so please feel free to message me there.
Concernant l'expansion des options de soins primaires au Nouveau-Brunswick. La porte-parole cet après-midi est l'honorable Dorothy Shepherd, ministre de la Santé. Speaking this afternoon will be the Honorable Dorothy Shepherd, Minister of Health. Minister Shepherd.
Good afternoon, everyone. Bonjour. It is my pleasure to be with you today for a very important announcement about a new project to give residents more options to access faster care and avoid long waits in the emergency department. This project advances commitments in the health plan to improve access to primary health care, as well as addictions and mental health services, and to make better use of all the health professionals across our province, including family doctors, nurse practitioners, pharmacists, and more. As you know, New Brunswick's hospitals are offering urgent and emergency services only as the system strains against the demands of the Omicron variant. About 60% of New Brunswick's typical emergency department patients could be treated in a community setting if more timely access was available. We can provide these individuals with better options to care and provide relief to the outstretched teams in our ERs at the same time. These changes will allow us to address the emergency department crisis while also evaluating new options for care and determining what works best for New Brunswickers when it comes to accessing healthcare services. Primary health care is a term used to describe the first contact a person has with the health system when they have a health problem or issue that is not an emergency. C'est le partie du système de santé que les jeunes utilisent le plus. Les médecins de famille, les infirmiers, praticiens et les pharmaciens sont tous des exemples de fournisseurs de soins de santé premières. It is the part of the health system that people use most. Family physicians, nurse practitioners, and pharmacists are an example of primary health care providers. Access to primary health care services has been an issue in this province for a long time. The New Brunswick Health Council has been tracking primary health care access for a decade. It released a new report in November that indicates 91% of New Brunswickers have a primary care provider, either a family doctor or a nurse practitioner. This is one of the highest rates in the country. However, only 57% of New Brunswickers reported going to their family doctor most often when they needed care. And this number has been virtually unchanged since the Health Council issued its first report on primary health care in 2011. When patients can't get care for their pressing health need in a timely way, they end up in our emergency rooms. It is not the appropriate place for that type of care at any time, but especially right now. Several days ago, I tweeted a picture of the Health Emergency Operations Center on New Year's Day. The room was full of people getting ready for Omicron, and they were connected to partners throughout the province, all working to get our system through this crisis. Throughout Christmas and over New Year's, that team worked on plans to get our province through the challenges we are facing today. They are working behind the scenes, even as I speak, doing their best to make sure New Brunswickers get life-saving care. The project I am announcing today is a critical piece of the work that began over the holidays. Through a partnership between the Department of Health, the regional health authorities, Extra-Mural and Ambulance New Brunswick, and community health providers, we are accelerating plans to provide New Brunswickers with solid alternatives to the emergency room in the community. Je tiens à préciser que les services d'urgence de l'ensemble de la province continuent à traiter des patients qui ont des besoins médicaux urgents, comme de douleurs thoraciques, de signes d'accidents vasculaires cérébraux ou de fractures. Si vous êtes en situation urgente et curieuse, devoir être transport d'urgence à l'hôpital, je vous exhorte d'appeler les 911. I want to be clear. Emergency departments throughout the province continue to see patients for their emergency health needs, including chest pain, signs of stroke, broken bones. Individuals who fear they might hurt themselves or others and victims of sexual assault should still come to the hospital. If you are experiencing an emergency and think you might need urgent transportation to the hospital, I urge you to call 911. An ambulance will be dispatched to your home just as it always has been. However, paramedics will use their clinical judgment to determine whether transport to the hospital is required or if other healthcare options are better suited to your needs. Paramedics are highly trained health professionals and are trained and qualified to do this assessment. Beginning Monday, they will have the option to treat and release. Si vous avez un médecin de famille ou un infirmier praticien et avec besoin d'accéder à des services de soins de santé généraux, vous devez toujours, au premier lieu, communiquer avec votre fournisseur de soins. If you have a family doctor or nurse practitioner and need access to general health care services, you should continue to contact your provider first for an appointment. If an appointment cannot be made in a timely way and the health need is pressing, other options are available before visiting the emergency department. Pharmacists can now renew prescriptions whether you have a primary care provider or not. They can answer questions about medications, prescribe treatment for minor conditions, including urinary tract infections, skin conditions, fungal infections, and answer questions about vaccinations. You can call 811 at any time of the day or night to receive support from a nurse and get a referral to additional services in their communities. The Telecare 811 service has been expanded to include in-person community appointments and virtual appointments that can be accessed within a 24-hour period. Walk-in clinics and virtual walk-in clinics like eVisit NB can provide a consultation with a nurse practitioner or doctor for common illnesses, injuries, infections, mental health conditions, and general health concerns. eVisit services are being offered at no charge to anyone with a valid New Brunswick Medicare card. To help improve access to services by providing faster first contact and reduce wait times, a new service delivery model called one-at-a-time therapy is now available in most of the addiction and mental health centers across the province. These services can be accessed either by appointment or walk-in. More information on available resources for mental health and substance use, both virtual and in-person, is available through Bridge the Gap. Given the speed with which we have pulled this project together, there will undoubtedly be bumps along the road. But I believe today represents an important turning point for primary health care in our province. Nous proposons aux Néo-Brunswickois et aux Néo-Brunswickois de vraies solutions de rechange au service d'urgence. We are providing New Brunswickers with real alternatives to the emergency department. We are demonstrating that we can use technology to connect New Brunswickers to the care they need. Pharmacists and paramedics will be using their training and skills to have an even greater impact on the lives of New Brunswickers. All of the learnings of this project will be used in the development of the primary care network promised in the health plan. Work remains to fulfill our vision of a completely integrated system of community services, and changes will be likely. However, these are critical steps forward that will inform our journey and provide New Brunswickers with access to better care. Thank you. Merci.
Merci beaucoup, la ministre Shepherd. Thank you, Minister Shepherd. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura droit à une question et un suivi. We'll now proceed with questions from members of the media. You have the right to pose your question in the official language of your choice. Each reporter will have one question and a follow-up. Avant de commencer, j'aimerais informer tout le monde que M. Richard Lausier, directeur général de EMAMB, est présent dans la salle si vous avez des questions à lui poser. Before we proceed, I'd like to notify everyone that Richard Lausier, the Chief Executive Officer of EAMMB, is present in the room should you have any questions. Laura Brown, CTV.
Hi, Minister. I do have a COVID-related question. Over 50 deaths since January 1st. There's a lot of questions as to why. I understand there are more cases because of Omicron, but are these due to outbreaks at nursing homes, or were they mostly already in a hospital suffering from something else? There are calls for more information on the high death rate. Can you tell us anything more?
I believe that you'll have a COVID update later this week, but what I can tell you is that the majority of cases have passed in hospital. So there's various reasons that we can just even anecdotally point to. The fact that our population is the oldest population in the country, the fact that we have a number of chronic illnesses in our population. And so all of these things play a factor. That's why vaccination is so important, why we continually push for vaccination, because it is your best protection, especially if you have chronic conditions, to avoid hospitalization, serious illness, ICU admission, and death.
Ms. Brown, do you have a follow-up?
Yeah, quickly. Are we still on track to moving to level 2 on Sunday evening?
That's going to be addressed as well later this week, but I will say the modeling looks good.
Thank you both. On va procéder avec M. Pascal Rochenock de Radio-Canada.
Bonjour, Madame la Ministre. J'aimerais savoir, qu'est-ce qu'il y a de nouveau dans ce que vous avez annoncé aujourd'hui, à part le fait qu'à compter de lundi, les paramédics peuvent maintenant faire du treat and release. Donc, à part de ça, est-ce qu'il y a d'autres nouveautés? Je ne suis pas sûr de voir qu'est-ce qu'il y a de nouveau ou de nouveau qui va aider à désengorger les urgences.
Thank you. I understand the question. One of the things that's most important is for people to know that they can access care without having to go to the emergency room. If someone has an emergency, they still should call 911. That's very important. But if you have a lower acuity of need, less urgent, not an emergency, you could call 811. And within a 24-hour period, they will be able to direct you to a virtual or in-person physician or nurse practitioner appointment so that your needs can be met, not only without waiting several hours in the emergency room, but in a very timely fashion. So that's certainly new. The eVisit NB contract that we have signed is a part of supporting this virtual and in-person visits, but we have many physicians around the province who have made appointments available so that we can make sure that we get to every part of the province. As well, your pharmacist can certainly help with prescriptions renewals and in assisting in minor ailments. So this is about showing New Brunswickers that not only have we been able to continue to utilize the services we've had with pharmacy and partners, but we're expanding it. We need to alleviate the stress on our emergency rooms and our emergency room healthcare workers. And so this is one way that not only can we do that, but we can provide better service to the people of New Brunswick for their healthcare needs.
Thank you. Monsieur Rachnog, as-tu un suivi?
Oui, j'aurais une question de suivi pour M. Lausier en français. Pouvez-vous juste m'expliquer, M. Lausier, qu'est-ce qui va se passer avec le 811 et ce que la ministre disait sur les rendez-vous numériques ou en personne qui peuvent être fournis sous 24 heures? Parce qu'on sait il y a quelques semaines, là, le gouvernement avait annoncé le projet pour les gens qui n'ont pas de médecin de famille. Là, l'initiative que vous annoncez aujourd'hui, est-ce que c'est aussi pour les gens qui ont un médecin de famille, mais qui ne peuvent pas avoir des rendez-vous rapidement? Expliquez-moi un peu qu'est-ce que ça va être concrètement, là.
I have to apologize. Monsieur Lausier would not be as informed about this as I would be. He is here to answer questions in reference to Ambulance New Brunswick. So what I can tell you is that this is a part of the health plan. And staff have worked very hard over these last few weeks to ensure that we were able to launch parts of our healthcare plan. This is a preliminary project that will give us good insight into how we can evolve the primary healthcare network so that every New Brunswicker has the opportunity to have access to primary healthcare, to see a doctor or a nurse practitioner when they need to. That's the whole point of this project.
Thank you. Andrew Wall with Brunswick News.
Hey, Minister.
Hello.
This project has the projected impact of what this is going to do with hospitals been factored into the modeling for hospitalizations for going forward? Like when we talk about moving to level 2, will this be factored in?
It will be later on, but it isn't right now. What I can tell you is that we have about 600 appointments a day available for this use. And so as we see the uptake and as we see the diversions from the emergency room, we do expect benefits. We expect ambulance offload delays to get better. We expect people to have better care sooner. We expect less wait times in the ERs. And so all of these things combined are going to result in better care, and I would hope less and fewer hospitalizations.
Mr. Wall, do you have a follow-up?
I certainly do. This sounds like a fairly significant increase in scope of practice for paramedics, pharmacists, potentially others. Are we talking, was there any money involved in this project? Are they going to get paid more to do these additional things, or is this, just literally we're expanding your scope of practice?
We've already negotiated with the Pharmaceutical Association for these additional scope of practice improvements. Pharmacists have been doing some of this for a while. I can also say that the Paramedic Association has been very enthusiastic about expanding their scope of practice within their work, and we do know that we have advanced care paramedics who have additional trainings who can be very supportive in these roles. This is really allowing everyone to work to their full scope of practice. And yes, there is for a limited time while we're under the crisis of Omicron, we have a new fee code that will be applicable. So when people are referred from 811 or the emergency room to one of those 600 appointments, there is a fee code associated with it. Whenever you increase access, you will increase the cost. But we know that this is what good healthcare is all about. So that's all being absorbed right now in our system.
Thank you.
Thank you. Vicki Hogarth with CHCO-TV.
Thank you, Bruce. Minister Shepherd, also from, a financial point of view, let's say a New Brunswicker went to an emergency room for a reason that could have otherwise been looked after by a family doctor or a walk-in clinic. How much more costly is it for a person to use an emergency room versus a family doctor? And will diverting from emergency rooms be a significant financial benefit to taxpayers?
Well, I believe it'll be a financial benefit. The emergency room is there no matter whether people show up or not. So those costs remain constant. This new fee code for these appointments, though, will offer better access to the care that individuals need in a timely fashion. So they're not going to be sitting in an ER for 4, 6, 8, 10 hours waiting to have something looked at that could have been addressed in an in-office visit. So this is why this is so important, because people will be getting their needs met, and the physicians and nurse practitioners that have stepped up to help provide this service are being compensated as well. So access always will cost more, but this is what this is all about to our population. Population health improves when they have access to primary health care.
Thank you. Ms. Hogarth, do you have a follow-up?
I do. I'm wondering if you can expand a little bit on how pharmacists will be integrated into prescribing medications. Is it just for renewals, or will they also be diagnosing some ailments? You mentioned UTIs as an example.
Yep, so UTIs was the most recent added to the pharmaceutical diagnostic scopes. And so they, they'll be able to prescribe for UTIs and for fungal infections and for some skin conditions. And of course, we'll see what the future brings with expanding on any of these services. But for right now, pharmacists have played a big part in our healthcare system with our vaccination rollout clinics, and so this is just one way that they've been servicing the public and how we can expand on it for the future.
Thank you both. Erica Butler with CHMA.
Thank you, Bruce. You mentioned the increased ability for paramedics to treat and release patients. I was wondering if there is any update on the effort to allow patients to be brought across the border to Nova Scotia, especially in the Tantramar area, where the local emergency room is only open 8 hours a day right now, and the Amherst Hospital is so much closer than the Moncton Hospital. Has there been any headway in that effort?
I can't give you anything on that today. We'd probably refer you to Horizon Health Network for comments on that, and I'll ask them to get you an answer.
Ms. Butler, do you have a follow-up today?
Yes, I do. I guess I'm still just trying to work out exactly what's new in this sort of package that's being announced today. What you're describing, the 811 referral to primary care, is this the actual launch then of the previously announced primary care referral program that we had heard about? Or?
This will most likely morph into that, but what we're doing now is really an ER diversion project. We're trying to lighten the load on our emergency rooms so that they are able to address themselves to urgent and emergency care. The flip side of that is that we do have the primary care network as a goal coming up very soon in this new year. And so this is going to give us the opportunity to examine how those services are delivered and how we can improve it if we need to make tweaks before moving forward with the bigger scope. And so I am excited because in the big scheme of things, this is the preliminary trial run, but we need to right now focus it on urgent care and the diversion from our ERs so that we can benefit our offload times, help our emergency personnel, healthcare workers that are frontline, deal with urgent and emergency care.
Thank you both. On va maintenant procéder avec M. Alexandre Boudreau de l'Acadie Nouvelle.
Oui, bonjour. Je me demandais si les salles d'urgence vont pouvoir refuser des patients si leur problème médical est jugé pas suffisamment grave. Est-ce que ces personnes-là, on va leur demander d'appeler le 811?
That's not the intent. However, emergency rooms could refer individuals to another location through 811. So it'll be done in collaboration, and it will be done in the best interest of the patient.
Monsieur Boudreau, as-tu un suivi? Une deuxième question?
Oui, peut-être une clarification pour Monsieur Lausier. Est-ce que les ambulanciers vont tenir compte des délais de débarquement dans les hôpitaux quand ils devront décider s'ils doivent transporter un patient vers l'hôpital ou les soigner sur place ou les transporter vers un autre service de santé?
Merci pour la question. Non, ça ne sera pas un facteur pour que les paramédics, quand ils vont aller sur scène, de déterminer. De toute façon, ils ne sauront pas nécessairement quoi que les délais de déchargement vont être à ce moment-là. Ça va être basé sur l'aspect clinique du patient, selon des protocoles qui ont été établis avec des algorithmes pour déterminer si le patient doit être transféré à l'hôpital, transporté à l'hôpital ou non. Donc, ce facteur-là, s'il a besoin d'être transféré, on transporte. Puis, si le patient n'a pas besoin d'être transféré ou transporté à l'hôpital, ils vont laisser de l'information où il sera mieux servi avec la condition qui est présente.
Merci beaucoup. We'll now go to Marie Sutherland with CBC.
Good afternoon. Minister Shepherd, you've said that e-visit services are available to anyone with a Medicare card, but with Omicron cases surging and chiropractors and dentists and veterinarians, everybody being asked to assist with COVID vaccinations, I'm just wondering how there are any healthcare providers available for this service.
Well, that's the whole point. This has been done in collaboration with the MBMS and eVisit NB to ensure that we have these additional 600 appointments available throughout the province. And so we have certainly maximized our vaccinators, and to the tune that we're able to do, I believe, 60,000 plus appointments a day, and I think we were working up to 82,000 to be available. So we're covering all our bases, and that's really what I'm so proud of with the staff that have worked on this tirelessly since before Christmas. And they've really looked at every aspect of our healthcare system to how we maximize these opportunities. It truly has been an all-out effort, and I'm grateful to each and every one of them for all the work they've done.
Thank you. Ms. Sutherland, do you have a follow-up?
I do. So in November, you pledged to make primary care available to all New Brunswickers in early 2022 by transforming the online registry of people without doctors into a referral system. I'm just wondering how close is that system to being up and running, and are you still looking at providing, I think it was 375 doctor appointments a week?
Yeah, so that's on the go as well, still being worked on, and actually Medivy is a partner in that with us. And so that's being put together. This project is going to help inform us in how that's going to go forward, and that's why this is so important. And I'm so thrilled that we've launched this part of it.
Thank you. Thank you both. We're now going to go to Suzanne Lapointe with Global TV.
Hi there. A common barrier to help with mental health, and we've established that during the pandemic, mental health and addictions is becoming a large concern, is often people aren't able to get controlled substances renewed by pharmacists because a lot of psychiatric medications are controlled substances. So with this change with pharmacists, are they able to renew prescription for controlled substances?
I'm not aware that they're going to be able to address this particular part. However, hopefully with these family physician appointments, we will be able to address that in a more timely fashion.
Thank you. Ms. Lapointe, do you have a follow-up?
Yes, I also want to know how exactly, you mentioned earlier that this would help address the problem of offload transfers at hospital. How exactly is this going to reduce the offload transfer times?
So first off, when we have treat and release, ambulances may not have to transport cases to hospital. And I think Mr. Logier could certainly speak to this after I'm done, because I think he would have some important information to relay to you. So we also have, we have many other projects on the go. So first off, if people don't have to go to the ER, then there'll be less people there to treat. If they're able to get treated in community, which will be far better for them without having to wait hours at the emergency room to get to see an appointment with a family physician or nurse practitioner, that will result in less wait times in the ER. If the ambulance doesn't have to transport to hospital every single call, then that will take up some of that space, free up some of that space in the emergency room for other calls. When we have, we now have social development working with admissions and discharges right in the emergency room. That's having an effect as well, and not having to admit as many patients from seniors or disability, and getting them back to their homes and their community sooner. This is going to be a culmination of many efforts that are going to help support frontline ER healthcare workers. And it's about getting the right care for the patient at the right time and in the right place. And I'm just going to ask Mr. Logier to speak to that.
Thank you, Minister. So regarding offload delays, of course, we believe this will help to diminish the volumes that will be going to the hospital. Every year we have approximately what we assume based on our numbers, 20,000 calls that are or at least less acute and should not be transferred, or potentially not being transferred to hospitals. They could be better served, I might add, by their family physician, walk-in clinics, pharmacists, calling 811, than going to the ER. Those numbers are recurring. When we speak to our paramedics, we know they know that also, and then they get caught in offload delays because these are not high acuity patients and they don't need the urgent service, so they will not be seen as fast. And there's one thing I will add to that. We're encouraging people to call 911 when it's an emergency. It's very important that it's clear when you have chest pains, you have a fracture, and multiple other emergency needs, that you call 911. What we're asking now, because of the current situation, is when it's not urgent, you sprain your ankle, you bumped your knee. Unfortunately, some people do call ambulances, and even some people post on social media that if you want to get through the emergency department faster, call 911 and get into an ambulance. That is totally false. And what that does, that concerns us dramatically when we see this stuff, because we're removing a vehicle and highly skilled professionals off the road that could be probably respond to more important calls. So that is crucial that that message is out there. 911, use it for emergency services, and we'll be there. So going back to the offload delay situation, if we eliminate those 20-ish thousand calls a year, it will have an impact on offload delays, and we're positive about that.
Thank you both. Ailish Bonang from CTV.
Thank you, Bruce. Minister, I would appreciate if yourself spoke to this, and also Mr. Logier, if possible. Certainly not discrediting the education abilities of paramedics and pharmacists, but the time spent in school to become a practicing physician is exponentially higher, which kind of leads me to believe that some patients won't be happy about a paramedic possibly refusing to transport them to hospital. Mr. Logier, you kind of spoke to it that, you know, people are trying to find loopholes on how to get through quicker. I'm wondering what you might say to folks who would have, you know, questions regarding the ability to make choices such as this by paramedics.
So what I can say is that, you're right, paramedics are highly trained individuals, and advanced care paramedics even more so. And so, this is not something new. This has been happening in Nova Scotia. It's been happening to our neighbors in Maine. And so this is something that they have distinct protocols for. So I'll let Mr. Loger speak to it.
So we've established with our partners, the Paramedics Association of New Brunswick. Since I have the mic, I will thank Chris Hood and Derek Assista, our medical director, provincial medical director, Department of Health, folks at A&B and Medivie Health Services to build protocols for this project. As a paramedic comes in, they always assess, every time they go on a call, they assess the patient, and they're very strong at that. They assess the patient, and then, because what the information they receive from the dispatch center is limited, because that's the information they receive by the patient sometimes, and it's not complete. Paramedics come in, they do a full assessment, and then they will determine, based on protocols and algorithms that have been established, if it is needed to be the patients need to be transported or not. If it's not, they will leave information. They will direct the patient to the appropriate or potential appropriate caregivers, and they could be better served than waiting hours in an emergency room or in hours in the back of vehicle in offload delays. So it's just better care for the patients. And then the urgent patients will be seen and taken care of in a better manner.
Thank you. Ms. Bunning, do you have a follow-up today?
Thank you both. I do. Minister, you mentioned that this is a preliminary trial run of this project. Is there a set end date for these changes, or is it kind of a, see how things run? And again, you mentioned starting Monday, I believe?
So Monday is when the paramedics will be beginning their treat and release protocols. And that's really just because we need to arm them with the additional information that they can leave with patients so that they know they're not, that they'll have the proper follow-up. But we soft launched the 811 and the ER referrals last week, and so that's ongoing. We do see evaluating this mid to late February. The contract with eVisit NB is contracted until the end of February, and we will be assessing their appointments and the other physicians and nurse practitioners that have come online for this. So the evaluation period will be between now and the end of February.
Thank you. Travis Fortnum with Global News.
Hi, Minister. I wanted to ask about COVID-19 vaccine rollout, specifically in the 5 to 11 age group. I know the past few days there's been something of a push to bring the numbers up among that age group. Wondering if the province is making any changes to roll out to get those numbers up.
There'll be more speaking to it later this week, but what I can tell you to date, we have 55.3% of children in that age group who have received their first dose. And so we surpassed the 30,000 mark today. We will continue to encourage those children to be vaccinated, because we know that the more of our population that's vaccinated, the more we can suppress transmission and try to keep our cases down.
Mr. Fortnum, do you have a follow-up?
Yes, on that note, NACI issued recommendations about around boosters for immunocompromised kids yesterday. Wondering if we're going to hear more about New Brunswick's plan to start offering those this week as well.
Most likely you will, but Public Health they just released yesterday, so Public Health is going to be going over that information. I'm sure Dr. Russell will have more for you on that.
Thank you.
Thank you both.
Thank you.
Tim Roselle with Global TV.
Hi, good afternoon. Minister Shepherd, I wanted to ask you about the memo that went out from the Department of Health last week to the professional organizations for dentists and chiropractors and veterinarians regarding training for vaccination clinics. Just wondering if you have any kind of a target for the number of those professionals that you'd like to have trained in that area, and what kind of uptake you've seen so far.
I don't have a number target because we're accepting as many as possible because vaccination is our priority. So what I can tell you is that even, everyone who gives a COVID vaccination received training in how to do that, and in certain specifics, I can't even tell you what they are because I'm not a clinician. But so that call out was to ensure that that all of these associations knew that we would welcome their help, and we'll get as many of them as we can.
Mr. Roselle, do you have a follow-up?
Yes, I do, Bruce. Thank you. And just to further expand on that, I wanted to ask you about the compensation for those professionals. I believe on the memo it said $142.80 hourly. There's a suggestion from opposition and even from some members of the medical community that that these professionals are going to be compensated quite exceptionally for doing this extra work, whereas nurses and paramedics, both active and retired, have been volunteering in these areas and perhaps not getting the same level of compensation. Can you tell me if the nurses and paramedics that are active and even retired that are coming back to help out, if they're getting any kind of similar compensation to what is being offered to the dentists and chiropractors?
I can tell you absolutely that every professional working on behalf of the regional health authorities is being compensated at the rate that their profession normally dictates.
Thank you both. Jeannick Godin avec Radio-Canada.
Oui, bonjour Madame la Ministre. On veut désengorger les urgences, soulager la charge des médecins de famille avec cette formule-là, diriger les gens vers le 811, le 911, services paramédics et des pharmaciens. Est-ce qu'avec cette stratégie, vous continuez aussi à mettre l'accent sur le recrutement de médecins de famille et la rétention des médecins qui sont en place dans notre système?
Of course, family physicians retire. They leave for various reasons. If so, what I did state earlier is that 91% of New Brunswickers have a family physician or nurse practitioner. That's one of the highest rates in the country. However, we've always continued recruiting. We work with the MBMS, we're working with our regional health authority partners to ensure that we continue to have opportunities for any physician who wants to work in this province. So that continues on a daily basis.
Monsieur Gaudin, t'as suivi?
Oui, et j'aimerais peut-être, si possible, une réponse de la ministre Shepherd et peut-être de M. Lausier aussi. Quand on fait affaire avec les pharmaciens et les paramédics pour soigner les personnes, ou mieux les diriger dans le système de la santé, est-ce que il n'y a pas un risque quelque part que les spécialistes soient davantage sollicités, c'est-à-dire que les médecins de famille, on les bypass, là, si vous me permettez l'expression, et que les pharmaciens, les paramédics, par exemple, dirigent les patients directement vers un service de spécialiste. Comment le système fonctionne pour éviter que on désengorge peut-être les urgences et les médecins de famille, mais qu'on augmente la pression sur les spécialistes?
I'm not sure I quite understand what you mean by putting more work on specialists. This is to deal with everyday primary health care needs. Those issues that come up to someone in a day who's had back pain for a few days, or someone who's not feeling well and they're not sure what's wrong with themselves. This is about not having to sit in an emergency room because you are triaged as a level 4 or a level 5, which is a lower acuity of need, and giving you better service by finding you a family physician or nurse practitioner in community that you can see within 24 hours. Many people, of those 91% of New Brunswickers who have a family physician, can't access their family physician in 3 weeks. So we need to make sure that people can get their health needs addressed in a timely fashion so that they don't get worse. And so 811 is a triage by a nurse to help understand if you know, what your needs really are. And they'll send you to what you really need. And if you have an emergency, it's very important that you call 911. Utilize that service because that's what it's there for.
Moi, je peux ajouter, M. Godin, du côté paramédic, ils ne vont pas référer à des spécialistes. Ils vont laisser de l'information et conseiller le patient ou la patiente de se diriger vers le médecin de famille, une clinique de son rendez-vous. La pharmacienne ou le pharmacien qui sont habitués avec, le 811 évidemment, mais en aucun temps qu'il ferait des références, parce que ça ne devrait pas être des cas qui nécessitent des soins à ce niveau-là. Des 4 puis des 5, comme exemple, ça peut être une douleur à l'oreille, ça peut être des maux de gorge, etc. C'est des mal qui ne sont pas... la gravité est vraiment moindre. Ça fait qu'à ce stade-ci, il n'y a pas question que ça s'appliquerait pour les paramédics.
Merci beaucoup. Thank you very much. Sarah Seeley with Brunswick News.
So my question is, I'm looking for some clarification on the criteria or different skills for the unpaid volunteer positions as opposed to the unpaid versus the paid positions. I was just wondering if there's kind of like a difference in skills that are needed for those jobs.
So what I can tell you is that we're asking for clinical individuals to step forward and non-clinical. And so those, we've actually received 3,500 volunteers who have called and put their names forward. I don't have the breakdown yet of the how much were clinical and how much were not. I can tell you that about 30% have already been identified, and I believe they're prioritizing clinical first. And so we hope that by the end of the month, everyone who has stepped forward and volunteered will be contacted. They'll be assessed and vetted, and when I say vetted, it will be to their skills to see where they can be utilized.
Ms. Seeley, do you have a follow-up?
Yes, I guess my question would be why some professionals are compensated differently than others for doing the same sort of tasks.
So as you can appreciate, every professional association has negotiated fees, and that is what the compensations are based on. We have for the most part utilized nurses for our vaccine clinics. We have put a push on to get vaccinations done as soon as possible and are therefore implementing as many professionals as possible to get this done, because it is the very best protection against serious illness, hospitalization, ICU admission, and death.
Thank you both. Mia Urquhart with CBC.
Thanks, Bruce. I'd like to hear more details from Mr. Lozier about how things will change for paramedics. Mr. Lozier, could you give specific examples of conditions for which paramedics would treat and release a patient rather than transporting them to hospital?
Yes. So once we get the 911 call through our dispatch center, our medics are dispatched to the address. And then they go on site and they'll do a full assessment, as they always do. Now what's going to be added to that are 2 different algorithms and protocols to make sure that they're comfortable, they're following due process, and helping them make the proper decision based on the acuity of the patient. So Your 1 to 3s are more urgent. So somebody who has chest pain, there's no question that they will be transported. Somebody who has an open fracture or a fracture of a limb of some sort, they'll be transported. Those type of calls, that's what we should be there for. Where we're going to determine when the proper caregivers should be involved is those lower acuity calls, a sore throat, a sprained ankle, a sore back, as the minister mentioned, that, it's been there for a week. Somebody had, I don't know, if they fell and they got a sore back, a throat ache, flu symptoms. Those type of calls would be better served by their primary clinicians or through 811 and getting the appropriate person to take care of those individuals instead of going to the emergency department for potentially long waits, because they will not be seen quickly because of their acuity of their situation. So there's no doubt in our minds this will help the system, and it's just better care for the patient. So that's where we see it, and we're going to be monitoring this very closely over the next few months. We're going to assess. We're going to look at every call, and then we'll determine how we make it better even moving forward.
That concludes today's press conference on primary care option expansion in New Brunswick with Minister Dorothy Shepherd. Just a quick recap of some of the things we learned today, and I honestly want to say I really appreciated the online conversation today on the Facebook feed. It was really engaging. You brought up some really good points, some of which I want to go over right now. So one of the things we learned is that there will be pharmacists now will be able to not just renew prescriptions, but in some cases make a diagnosis and prescribe. So in the one example that Minister Shepherd gave was UTIs, so urinary tract infections. That's obviously a thing. Most people, when they have them, they know it, and to go to a doctor or the emergency room is just this added step in something that they pretty much know the answer to and what needs to be done. So that's actually a really great addition to, and I'm sure there will be a long list of things that they will be able to diagnose and prescribe medication for at the pharmacy. Some of you online brought up the point, will you need an appointment though to see a pharmacist? So that's a really good question. I wish I could have asked it. And then on the other topic of paramedics also being given the power to what's it called? It's release and to prescribe, or not prescribe, release patients, but to treat and release. Okay, so that was the way they worded it, to treat and release a patient. So if you call a paramedic and it's something that's non-urgent, now they did mention that if it is urgent, obviously if it is a 911 related thing, they will still be going to the hospital. And I'm sure if they deem it serious, yes, that will always be the case. But if it's something that isn't, that they can treat and release, I think obviously if the patient or person in question is compliant with that idea. But many of you online brought up a really good point, is will you be still charged the $130 ambulance fee? The transport fee that you get if you do take an ambulance to the hospital usually comes in the mail after. So that's a great question. I will try to find out, and I'll post that information either online or in a news story later in the week, but I will try to get answers to those. That's why I do really love the conversation online. We've had chats sometimes about, I know some people have said, why do we keep it open, especially in the time of COVID, where opinions can be really polarized and there can be a lot of clashing. I do find for the most part people are respectful and engaging and contribute to the conversation and to the questions and concerns that we all have as New Brunswickers. So for the most part, I think that I really do love having the chat open. So thank you to all of you who watched online and contributed or who sent emails in during the press conference. It's always wonderful to feel that you are a part of this with us, and we really do appreciate it. Thank you for joining me today. I am Vicki Hogarth at the CHCO News Desk. I will obviously see you later in the week for another COVID-19 update. Bye.
This has been a news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.